Here are some do's and don'ts for handling the 4 most common injuries. Bruises. Use the RICE method. Rest, ice to prevent swelling, use light compression as needed, and elevate the bruised area. Don't apply heat by taking a hot bath or shower. This can cause swelling. Cuts and scrapes. Clean wounds with soap and water to clear out any debris, and then apply a topical ointment and cover with bandages or wound dressings. Don't use alcohol or hydrogen peroxide. It can burn the wound and damage nearby healthy cells, which can slow down the healing process. Burns. Apply a hydrogel bandage to soothe and cool the wound, or apply a clean wet towel or sheet. Don't apply any greasy items like butter, ointments, or sprays. This can trap the heat and intensify the burn. Sprains. Use the RICE method again. Rest, ice to help prevent swelling, compress with a self-adherent wrap or elastic bandage, and elevate the sprained area. Don't agitate the injured area, which can increase the severity of the sprain. In case of an emergency, seek medical attention immediately. CURAD, a deeper level of care.